3 Ps exam questions with complete solutions, latest 2025. The groove of the metacarpophalangeal joint can be palpated by having the patient. Correct answers: white heavy check mark, flex his hand. When auscultating breath sounds in a patient who has left-sided heart failure, the breath sounds are correct answers: white heavy check mark, vesicular with late inspiratory crackles in the dependent portions of the lungs, and resonant on percussion. The ankle brachial index is a screening test used to assess a person's risk for correct answers: white heavy check mark, peripheral artery disease. Olecranon bursitis may be caused by all of the following, except correct answers: white heavy check mark, frozen shoulder. In patients who have allergic rhinitis, the nasal mucosa appears. Correct answers: white heavy check mark, pale. A term used to describe an increase in muscular bulk with diminished strength is correct answers: white heavy check mark, pseudohypertrophy. If abdominal pain persists when the patient raises his head and shoulders, the origin of 1/3. 3 Ps exam questions with complete solutions, latest 2025. The tenderness is probably correct answers: white heavy check mark, in the abdominal wall. On auscultation of the abdomen, rushes of high-pitched sounds are audible and coincide with abdominal cramps. These findings are most consistent with correct answers: white heavy check mark, intestinal obstruction. Ophthalmoscopic examination of the fundus reveals tiny, round red spots in and around the macular area. These findings are consistent with correct answers: white heavy check mark, microaneurysms. Symptoms of a subdural hematoma include correct answers: white heavy check mark, noticeable bleeding between the dura and the cerebrum on X-ray. On examination of the adult patient, symptoms of flexed posture, tremor, rigidity, and shuffling gait are observed. These findings are consistent with correct answers: white heavy check mark, Parkinson's disease. When discussing the musculoskeletal system, all of the following statements related to 2/3. 3 Ps exam questions with complete solutions, latest 2025. Articular structure disease are true, except which one? Correct answers: white heavy check mark, articular disease is usually due to stiffness or pain. Focal tenderness over the trochanter confirms. Correct answers: white heavy check mark, bursitis. Assessing the neurological status of a child with a ventriculoperitoneal shunt should include correct answers: white heavy check mark, use of the Glasgow Coma Scale. The earliest recognizable clinical manifestations of cystic fibrosis in an infant is correct answers: white heavy check mark, salty taste on the skin. A reddish blue, irregularly shaped, solid and spongy mass of blood vessels that may be present at birth and enlarge during the first 10 to 15 months is characteristic of a correct answers: white heavy check mark, cavernous hemangioma. The hamstring muscles flex the knee and are located on the correct answers: white heavy check mark, posterior aspect of the thigh, powered by TCPDF, www.tcpdf.org. 3/3.